all of us. And to maintain independence as we age, some risks should be addressed.
Modifications at home don't have to be expensive or elaborate. We'll take a look at a few simple solutions in today's Healthy at Home.
Well, she's from Advanced Home Healthcare. We're pleased to welcome back Jessica Shaven.
Nice
Good
to
see
see you
Jessica.
again,
Thank
Jessica.
you.
We almost had our last guest almost fell over a light walking off the.
Don't say which one.
I'm not saying.
Don't want to embarrass
but
anybody.
these can be serious. There's a lot of risks in our homes, not only in studios here, but in our homes when it comes to falling.
Yes, absolutely. And a lot of these falls lead to fractures and injuries, head injuries, and this can just result in further issues for seniors especially.
You have a home health care as a registered nurse. Maybe we should back up a little bit. You're a registered nurse, and you noticed that there was a real need for a different kind of home health care agency.
Yeah.
So what were you noticing that was missing?
Well, a lot of times people can stay in their homes, but it just takes a few modifications to allow that to happen. And what I offer is a free consultation. I come into the home, I assess the environment, I give a full report for free as to what my recommendations would be. And a lot of these changes can be home modifications. Bars installed, shower seats, even just a simple, a different shower handle can make all the difference in the world.
So some of these, it doesn't cost a lot of money. Sometimes it's a matter of just rearranging furniture.
Absolutely, yeah. Or changing lights, adding lights. Oftentimes as visual changes happen in seniors, they have a hard time seeing, and it's just a matter of getting more light in the home.
You mentioned a few of the modifications, and we have pictures of them. So let's spend a little bit more time on each of these.
Okay.
This is the shower. So the idea is that maybe the floor gets slippery when wet, or you're reaching too high to get to something. So it's just making it more accessible.
Yeah, and this shower handle actually moves up and down. So even if we put a simple shower seat in the bathroom there and lowered the shower handle, they could sit the entire time and still keep warm.
And the bar's there in case they feel like, they're losing their balance. They've got something to hold on to, so they don't have to worry about falling there.
Yes.
Sticking with the bathroom, I think, what is our next picture?
Well, there's the
chair. Yeah, there's the simple shower seat. It's not, it's totally waterproof. It has the rubber feet. It won't slip. It's, you can arrange the height. Change how it's the width of it also, depending upon the patient.
Give us an idea of a cost on a chair like that.
A chair like that, you're looking at around $50, $60.
Yeah, what are we looking at here? That's a hinge.
Yeah, this is a hinge, and it's a modified hinge, and it actually will give you up to 4 more inches of width in that doorway. So if someone has a walker or a wheelchair, they may not have to make huge modifications to a doorway.
Because sometimes the door itself gets in the way of the width of the opening.
Exactly. Yep, and these hinges are $10 a pair. I mean,
wow, and you can make that change. This
Yes.
is something you're not just giving them the hinge, but you're coming in and doing the work.
Yep, we're actually doing the work. We just set up the appointment and come in and do it. It takes a matter of minutes is all.
I think if you have, maybe you've lost some leg strength, and it's hard once you're seated to get back up, this would probably come in handy.
Yep, absolutely. You don't have to squat down as low. The seat is 4 to 6 inches high. There's different heights. And also we can install grab bars along the sides of those to help the person get up off of the seat even more.
What are some of the injuries that can come about because of falls?
Well, any type of fracture. Hip fractures are common, wrist fractures because they go to catch themselves with their hands. Also head trauma, and that can lead to stroke or cognition.
But you hear about it all the time. A senior maybe has a certain type of fall in a home. It leads to other complications, and then a lot of problems.
Yeah, absolutely. Falls can lead to blood clots, any number of things. And oftentimes they're too afraid to mention it to family or to their healthcare providers because they think if someone knows I fell, I'm going to have to be put into a nursing home. And that's just not the case. You need to tell somebody about it if you fall because, as I said, there's a lot of other risks involved.
But this is really, and for you, just like for the people you're helping, this is about staying at home longer instead of feeling like you have to give up what has been the most like your sanctuary, right? The most important place on earth for you. You don't have to leave it necessarily.
No, no, and like I said, I can come in, I can give you the full report of just some simple changes that can be made, all the way from simple up to more complicated, depending upon the situation. But I'll be glad to give you a list.
Right, and so that assessment, when you go inside the house and look inside the home, that's a free assessment?
Yep, it's a free assessment. It oftentimes takes up to 2 to 3 hours, and it's completely free.
Wow. You can learn more about Jessica and about Advanced Home Healthcare online. The website is homehealthcareomaha.com. You also see an email address there and the phone number to schedule that free consultation to make sure that your home is as safe as it can be. It's 402-490-3120. And if you're into social media, you'll find Jessica and the team on Twitter and on Facebook. Thank you, Jessica, for coming in.
Thanks for having me.
We appreciate your time.
Thank you very much.
So it's